Hello. In today's edition of Brain Gist, I'll be answering a very simple question. Is migraine curable? This is a question I get to answer, oftentimes in the clinic, in a headache clinic, and I'm meeting a patient for the very first time and I have diagnosed them with migraine. So before I go ahead, I'd like to thank those of you who've been watching regularly and I appreciate you for your comments and your time and everything, your support. It means a lot to me. And for those watching for the very first time, this is Brain Gist. Here we talk about the brain and its disorders and how to cope with them without allowing them to take control of your life. So, is migraine curable? Well, like I said, it's often a question I have to answer each time I diagnose migraine. The typical scenarios: a young lady accompanied by the parents to the clinic who's been having headaches for a couple of years, and those headaches are getting more and more frequent to the point that it's now affecting her studies and life at large. And the headaches sometimes have become daily. And then, of course, I take the first 20 minutes to listen very intently to the story, let the story unfold, and I ask questions about the various other things I want to know to help me conclude on the diagnosis. And of course, I examine the individual. And when I am convinced that I've gotten enough information to make up my mind about what I think the diagnosis is, at the point of sitting down or settling down to now start to talk to them, the first question I often find myself asking is, what are your expectations from this consultation today? And I found it quite revealing because, that's a point where I tend to learn a lot from patients because, sometimes what I thought their expectations should or would be is often different from what they want to achieve. And oftentimes they tell me, we want to know why this headache is there. And then, okay, of course, I know that you would want to know. And then sometimes the next set of expectations can often be very, very, different. And then they might say something like, okay, we want the headaches to be cured. We don't want her to ever have these headaches again. And that is where you really have to have very, very frank discussions about what you've diagnosed and what the implications are for the future. So the truth is, when I diagnose migraine, I often tell the patient straight away that migraine cannot be cured. And I see some of them looking like their hope has just been dashed. But that is not to say that there isn't anything we can do about migraines. Of course, there is a lot that we can do to make life better. So I've defined in many of my previous videos that migraine is an inherent tendency to have, headaches of some kinds. So that tendency certainly can be modified, albeit you may not be able to, remove that tendency completely, but we can make it a lot better. So migraine can be improved a lot. And there are different interventions that we can make to improve this tendency. And one of such interventions are, medications, preventative medications. I've talked about preventative medications a little bit in some of my previous videos, and I hope to be able to talk a bit more about them in future videos. But more importantly is the fact that there are lifestyle interventions that can, be made. There are lifestyle practices that can be altered or improved upon that can transform, the lives of people who've got migraine, that can make their migraines much less and make their lives much better. And certainly in my future videos, I'll be dedicating one video to each lifestyle intervention. So you will benefit a lot from subscribing to this channel and staying tuned to it so you do not miss any of the things that will be released from this channel. So I think the very first thing is that everyone who's been diagnosed with migraine needs to take ownership of it, of the diagnosis. You first of all need to understand what migraine is, and then you need to know. And one thing I find myself telling them most of the time is that if my diagnosis is correct, it means you would still have more headaches in the future by definition. So, but then we can help to make your life better. But I say without fear of contradiction that it's a very, very difficult job for a doctor to want to improve migraine all along without carrying the patient along. A patient does have a very huge role to play, and that's why it's a shared responsibility. And so the patient must first of all understand what migraine is. And then one of the things I tend to do is to dig into the history to find out those factors. And more often than not, I find those factors present, at least 1, 2, 3, or even more in a given patient's life, those factors that need to be improved upon to improve their migraines. So it starts with you owning the disease, getting educated about it, and getting to know what those factors are that you can modify to improve your migraine, and how to modify those factors to improve your migraine frequency and or severity. So if you haven't subscribed, I encourage you to please hit that subscribe button, and in addition put on your notifications so that you get promptly notified with every interesting video that I release once a week. So thank you very much for watching today, and I'll see you in my next video. Please continue to stay safe, and bye.